Meghan Markle just revealed a rare and scary medical condition that she suffered after childbirth called postpartum preeclampsia. What is it? And how do you treat it? Is it fatal?
Yeah, Dr. Wendy McDonald joins us now to tell us more about that and some other issues considered before, during, and after pregnancy, because I didn't know you could get it after pregnancy.
You can get it after pregnancy, and you can get it at any time during the pregnancy.
Yes.
It's not uncommon. Yes, but it's not uncommon for somebody to be like 38 weeks and suddenly has preeclampsia. And a lot of my patients, if I tell them, hey, you have preeclampsia, they're like, well, but I've been fine this whole time. But that's how it gets you.
Yeah.
It comes to get you sometimes at random times. And so she said, Meghan Markle said it was rare, but actually the stats show it can be anywhere from 3% to 25%
Oh, really?
of pregnancies to develop postpartum preeclampsia. And it can happen even up to 6 weeks after delivery.
So what is
Yeah.
it?
I was like, wait.
So it is hypertension, high blood pressure, okay? Often you're also spilling protein into your urine, which our urine does not typically have protein in it. That's one of the ways that we diagnose it.
Okay.
The biggest way that we diagnose it is by high blood pressure. But symptoms people can have: headache that won't go away, pain under their liver, which is like the right upper quadrant. They can have visual changes. They can have just like, feeling really, really out of it. And so it's worth checking a blood pressure. And I always tell my pregnant people, have a blood pressure cuff at home. Have an automatic monitor at home, because it's one of the first things that we ask if a person calls and says, hey, I have this headache, it won't go away, Tylenol is not taking it away, what's your blood pressure? Or come in, let's check your blood pressure.
Because it's one of those things, too, that all the symptoms you describe, you can write off as something else.
You can, unless they don't go away. Like,
Right.
that's the rule of thumb. Like, yes, pregnancy can bring about a whole lot of symptoms.
Yeah.
Actually, preeclampsia used to be diagnosed also with swelling in the legs, and we took that away because everybody
people
swells.
swell.
Everybody swells, so then everybody's worried. But like, that is also one of the things that can happen with people with preeclampsia. But it's really a syndrome that can lead to seizures and even death. So it can be really, really dangerous.
Yeah.
And it's good for people to just be aware that it's out there.
Okay, real quickly, you say if it doesn't go away. What do you mean? Like it doesn't go away in an hour or two? Doesn't go away in 24 hours?
Yeah, I mean, if you have like a really bad headache and you're in pregnancy or postpartum and you take a Tylenol and in 30 minutes or an hour it's not gone, it's worth making a phone call.
Okay.
Or say it's hard to reach your provider, because I know that's one of the issues I think with like maternal health and Black maternal health. It's like, are we communicating with our providers? Are our providers hearing us? Are they listening? Having the more information, the better. Okay, so if you have these symptoms and you're concerned and you check your blood pressure and it's also 145/95,
Yeah.
that's a problem.
Right.
That's time to either go into the office, go into the hospital, be evaluated.
So what do you tell your patients before when they're talking about getting pregnant? Because isn't that where you can stem a lot of problems? I mean, not all, obviously,
Sure.
but the leading up to it part.
Sure. Well, there are risk factors for some of these things. So some of them we can control, some of them we can't, right? So if you have high blood pressure, trying to bring that down. If you're overweight or obese, trying to bring that down. But like our age,
Yeah, right.
being 35 or older is a risk factor. Having a C-section is a risk factor, which people can have preeclampsia even with vaginal deliveries. I had a regular, vaginal delivery and still had preeclampsia, but C-section is also a risk factor, but we can't prevent that, right? But it's good I try to tell my patients what to look out for,
Okay.
what to be, kind of on the lookout and when to call us. Yeah.
So this is coming up on Black Maternal Health Week.
It is.
So what are the major messages that are going out during this week to people?
And so the message often that you hear over and over again is that Black women are 2 to 3 times more likely to die from childbirth or childbirth-related complications than women that are not Black. That's including white women, Asian women, Hispanic women. But what I really want to focus on is those symptoms, those signs, and also one of the things we don't talk about that much when it comes to the risk of mortality and morbidity after delivery is actually postpartum depression.
Yes.
Meghan Markle had that too. She talked about that that they weren't letting her get help, but suicide and harm is actually a really high risk. It's one of the highest risk factors for maternal death,
Yes.
or postpartum death. And so it's one of those things to just be aware of, and also to tap in with our healthcare providers, our mental health providers, making sure that we are having our therapy appointments, or we are looking out for signs and symptoms of depression or anxiety. So
It's unfortunate, I think, that they termed it baby blues, because you make it seem so mundane and not important. When does a woman know that it's more than just her hormones re-regulating, or she's going into severe postpartum depression?
So baby blues is actually a term coined for those first 2 weeks after delivery, when you're just feeling somewhat down, a little
malaise,
lethargic,
right?
malaise,
Yeah.
a little sad. But depression is like you don't want to do anything, you don't find joy in this space, and it lasts longer than those 2 weeks.
Okay.
So now we're at 3, 4, 5, 6 weeks, and we're still down. That's not baby blues anymore. Now we're potentially at risk for postpartum anxiety or depression.
Does that help happen to a lot of women that say don't have help? Because, you know, have times have changed. A lot of women think, well, I can do this by myself. It's just a little baby. I can handle a little baby by myself, and not get help from people when they really need it.
I think that's huge. Help is huge. Sleep is huge.
yeah.
I always tell my patients, don't let people come over to your house and hold your baby all day and then go home and sleep in their bed. Like you need to be asleep at night too. So try to have people to come over maybe to help at night, or maybe to cook you some meals, or come and wash some dishes, because all they're doing is they're getting the cuddles, right? And you're probably sitting there like, you know, hanging
at
out
them and
with
talking
them.
to them.
Exactly. And then you're up, you know, for the rest of the night. So really trying to tailor our help is really key, but also just knowing that this is a time where the hormones are fluctuating and we are fatigued. And so all of that's going to also, like, almost we want to give ourselves permission to feel what we're feeling.
Right,
And
right.
that there are reasons for it. And it's not because you don't love your baby or you
Right.
didn't, you know, you're not a good mom. It's because there's a lot happening
There's
right
a
now.
chemical imbalance. I mean, it's
a lot
it's
happening.
going on. And I understand too, just because it happened to my girlfriend, she had bad postpartum with her first child. They treated her before her second child was born, so she didn't have the problems.
Yes,
It made it
yes.
much more enjoyable for her.
If you even have a history of anxiety or depression or postpartum, you should be getting that help and that therapy and potentially even meds, you know, if needed during the pregnancy. I 1,000% support that, because if you're not good, your baby's not good. You know
Right.
what I mean? So you want to make sure that you're taking care of the both of you.
Some important information.
Yes.
Dr. Wendy, thank you so
Thank you for
much.
having me.
For more information, you can visit loopobgyn.com, give them a call, or follow Dr. Wendy on social media at Dr. Everywoman.